Okay, so this phase is about core and pillar stability. So that's about our pelvic tilt, our spine alignment, and our shoulder blade alignment. On this, we're going to focus primarily rib cage to hips. This is super important to engage, learn how to brace properly. For every one of our lifts, it's going to determine how much strength we have, because the purpose of our core is to transfer weight from our upper body, from our shoulders or hands or a bar that we're loading in there, down through our core into our hips and into our feet. So we need our feet strong, but we also need our core strong. If there's an energy leak here due to different positioning, different alignment, if we're out of alignment in any way, that energy leak is going to put us into a very high risk of injury. So to start off with, you're going to need to grab a weight and you're going to be laying on the floor. So I'll take this shirt off just so you can see a little bit better what we're doing here. We're going to grab a weight, 10, 15, 20 pounds should be just fine. Lay down with your feet on the floor, the back side of your tailbone on the floor, your shoulder blades and your head. There should be a slight gap in your low back, not a massive gap in your low back. So just a tiny little gap there, and then put the weight on your stomach, just underneath your rib cage. The first thing we have to do is learn how to breathe in our diaphragm versus what most of us do, which is breathing up here in our chest. So a lot of people, when they breathe, it's all up top in their chest. What we want to do is we want to breathe deep into that diaphragm. And you'll see the weight elevates as I do that. And we want to think about putting pressure all the way around. 360-degree breathing is what I call this. So as I do this, if I poke in any position here and I breathe in, I should push my fingers out. And I recommend that you try that in all different angles around your sides, around your stomach, and around your back, because that's super important to understand. So what we'll do when we're bracing is we want to inflate first. Then we're going to flex all the muscles, starting internally and ending with our outside abs, our abdominals, our obliques, all of that. And then exhale and relax. You shouldn't be able to hold this too long because it's going to be a little bit stressful. It's going to cut off a little bit of the blood flow down into your lower half. So it shouldn't be a long brace. You need to breathe between reps. But we need to understand this breathing technique. Breathing in, brace, and breathing out. Notice as I do that, there's no movement out of the low back. Many people, as they do this, they just arch their low back to try and push the weight up. That's not the purpose. The purpose is to isolate that breath while keeping that stability in our core. And then flexing it. Another way to think about this is engaging the deep intrinsic muscles. Think like you're trying to stop yourself from taking a piss. Engage deep in here, almost suck in, feel everything deep inside working, and then while there's tension, breathing in and trying to push the air into that tension. So I'm flexed in here, nice and deep. And that tension pushes out in all directions. So no matter where I push, there's always pressure coming out. And just like if you were to load a car on top of a tire, if that tire is flat, the pressure of that car goes into the rims. If our core isn't braced properly, the pressure from that weight goes into our spine. If we are braced properly, the pressure of all that weight goes through the spine into the floor, and everything is good. The pressure is equal and it disperses properly. So the next exercise we're going to do is a bird dog. And we're going to use this to, again, work on our pelvic control. So I'm going to stick this on the back, go onto the hands and knees. And in this position, what we can do In this position, what we can do is we can isolate that pelvic tilt. We can flex in, we can extend. We should be able to shift through there a little bit and understand that movement. Once we have our neutral spine, which is, again, the dowel on the back of the head, between the shoulders and the back side of the tailbone, we're going to lock that position in, keep that tension, and we're going to extend one hand and the opposite leg. So dig the toes into the floor, engage the core 360 degrees around, engage your hand, and then lift your opposite hand and leg and extend for distance. Once you've got that and you're pretty solid through there, you can start doing this with your knees up. So again, I'll engage my toes into the floor, fingers into the floor, get my good posture, and then lift the knees up about 1 inch. And then we're going to hover the hand and the leg, and we're going to reach out for distance. This is a good test. If you can do this while balancing something on your back and maintaining that right stability, alignment, and positioning without shifting everywhere, you've probably got pretty good core stability, and you can handle that transfer of force from the upper body to the lower body. The next exercise is a cat-cow. A cat-cow is basically going through a full spinal flexion and extension. So flexion, we're going forward, trying to get every vertebrae in the spine to fully flex in, all the way from your head, all the way down to your tailbone. And then what we want to do is we want to go into extension, rolling every vertebrae into extension, trying to arch that low back, stick the back of your head to the sky, and pull into the floor with those fingertips, pulling towards your knees. And then as we do this, there's a few different ways we can do it. We can just simply go through flexion and extension, or what we can do is we can try and articulate each vertebrae independently. So I'm going to start at my tailbone, and I want to just go one vertebrae at a time, flexing in, trying to keep everything else straight, while just one vertebrae at a time starts to flex in. Once you hit maximum flexion, I like to slide forward and back a little bit, just pushing through each vertebrae, and then from there, again, we're trying to articulate one vertebrae at a time into extension, starting at the tailbone and working our way to that upper back, shoulder blades down, head starts coming up, and we can squeeze into extension here. And that full articulation of the spine is super important. Again, if any part of the spine can't move, it can't do what it's supposed to do, then we're setting ourselves up for injury, because if you have 3 or 4 or 5 vertebrae in a row that are getting loaded and they can't disperse pressure, they can't move independently, that area, top or bottom, is going to take way more load than it needs to.